Next, we're going to go to the bones of the rib cage and associated bony regions slash structures. It's not a terrible thing to go from thoracic vertebrae to the rib cage. Now, vertebral, thoracic cage. Excellent. Get rid of these attachment sites. Down, so you don't get them. Your clavicle is here. Your clavicle is going to have an articulation with this sternum right here. Your sternum's going to have several parts to it. We're not naming those specific parts. If you want to get ahead, this is the manubrium, this is the body of the sternum, and this is the xiphoid process of the sternum. But if you don't want to get ahead, you can ignore that. So again, your clavicle is not going to be labeled here. Okay, this is your clavicle. It's really more part of your shoulder girdle. I think I could rearrange this so that your clavicle's in with your shoulder structures along with your scapula. Yeah, we have your scapula coming up right now. In fact, thoracic cage, let's go back to shoulder girdle for just a second. Pectoral girdle, shoulder and arm. Anterior, here's your clavicle, that's better. And there is your scapula. So let's do all your clavicle and scapula stuff here and then go back to the thoracic cage. One thing on just your scapula, take those off, is we do have the glenoid fossa, also known as the glenoid cavity, depending on who your resource is. So this is facing laterally. Your head of your humerus is going to articulate into this glenoid fossa or cavity on the scapula, and that's going to be part of that ball and socket joint of the shoulder. Now this is calling it glenoid cavity. Usually if it's a fossa, it's going to be like a shallow sort of concave surface, and I think that's actually a better descriptor. Personally, you can use either one. Okay, the other structure of the scapula you need to know is the spine of the scapula, which is right there. There's the spine of the scapula. That's an important landmark. We're going to refer to things that are superior or inferior to the spine of the scapula. It's an attachment site for a lot of muscles. It's definitely worth knowing. Now, anything other than the clavicle? No, we can go back to the rib cage now. Thoracic cage. Ribs are also known as costals. So when we say costal cartilage, we mean the cartilage associated with costals. You do have different types of ribs. We'll stick with anterior and then we'll move on. So you have true ribs. True ribs each have their own dedicated costal cartilage. Once you get to, let's say, here, arguably this is the last rib with its own dedicated cartilage. And then you have the start of what we call false ribs. So all of these ribs, these three ribs right here, are going to hang on to this guy's costal cartilage. So they don't have their own dedicated costal cartilage. They just hitch a ride on this guy. And then you have two floating ribs. Floating ribs are also categorized as false ribs. So you have a total of 5 false ribs. So 1, 2, 3 that have cartilage and 2 that do not have cartilage. The ones that do not have cartilage are known as the floating ribs. Okay, floating, costal cartilage, true ribs. Yeah, I think that was actually it. I think the only thing to add on to this is the hyoid bone, which we'll have to go over here to get to. So the hyoid bone is kind of an outlier. It's kind of a weird one. In fact, at my old institution, it's the only one we were missing. We only had one on a skeleton, and it's always sort of articulated weirdly onto a skeleton. There's no true articulation with any bones on the skeleton. It's all soft tissue. It's all muscles and ligaments and tendons that are keeping that hyoid in space. So that hyoid is going to raise and lower with the swallowing. And because it's all just attachment sites. So it's, I mean, it's the reason that your neck goes in and then down rather than just like a diagonal that you would have here. So let's all be glad for that hyoid. It's not the same thing as the Adam's apple. That's the thyroid cartilage is actually the Adam's apple. That's your voice box. So those are two distinct structures. And I think we're just identifying the hyoid. I don't think we're worried about greater or lesser horns of the hyoid versus the body of the hyoid. I do like this representation here of how it's floating right there. That's a little bit better. I think I'm going to go ahead and move on to pelvic girdle in this as well. We're kind of doing shoulder girdle and pelvic girdle just because this is only a 5-minute video right now. So let's go to pelvic girdle. Hip and thigh, anterior view. Sure, why not? Now, the word pelvis means the sacrum and these coxal bones right here. So let's look at what are they going to refer to the coxal bone as. It's always an interesting thing. It's got several names is the problem. We're not going to have a specific name for the coxal bones. Can I not? Hip bone. We're going to call it hip bone. Okay, let's go super not clinical. I don't like the word hip bone for this. This is the coxal bone. It's also known as the os coxae, and it's also known as the innominate, which very ironically means that it doesn't have a name, which obviously it's got at least 4 names. Lots of cooks in this kitchen. Lots of people trying to name this thing. Nobody likes the name. It's easy. The only problem with coxal is that people mix it up with coccyx, which is why os coxae is also an option. So your pelvis is the combination of both of your coxal bones plus your sacrum. The problem with that is that your sacrum is an axial structure, while your coxal bones are actually the start of your appendicular skeleton, which is to say your appendages. It's part of your leg, essentially. Now, these coxal bones do have 3 parts, which are on your list. Your ilium is this superior flared area right here. This is your ilium. Your ischium is the thing you're sitting on. This is called the ischial tuberosity right here, and that translates directly to giant butt potato. So that's another really fun translation that we get today. So your ischium is what you're sitting on. And then to the anterior, you have your pubis. That's where your pubic stuff is. So that's an anterior structure. It does take some doing to really be able to orient this coxal bone to figure out which way is anterior. We've got the lateral view here. We've got the medial view here. So we're looking at this view, and then we're looking at the same bone on this view. You can see right here, this is the acetabulum, right there. That's part of that ball and socket joint for the hip. That means that that's lateral. You don't have the ball and socket here. That means it's a medial view. So that can help you orient. This is called the obturator foramen. It's not on your list. I'm just pointing out that it is different from the acetabulum so that you can start orienting. Now your acetabulum is on your list, so we got that. And then I did show you the pubis already, but I'm going to show you one more time, and then I'm going to go back to the pelvis in general and show you the pubic symphysis. So again, your pubis is this entire anterior, it's not officially an anterior arch. I'm going to use the word anterior arch to be descriptive, but nobody calls this an anterior arch. So of your pelvis, this is the anterior portion. It's associated with genitalia, for example. Lots of attachment sites for a lot of different muscles. Some of those muscles go to your legs. And then you have a pubic symphysis, which is a specific kind of articulation. It's a fibrocartilaginous pad. I really hate this angle. That's a terrible, terrible angle. Let's do female pelvic girdle. And yeah, that's a way better angle. Oh, look at that. That's a way better pubic symphysis. And this being a female pelvic girdle is much more relevant for that pubic symphysis. If you've ever been pregnant or know somebody who has been pregnant, during pregnancy, this can loosen up and create a lot more mobility in that pelvis and a lot more mobility when walking. and this can be injured during the birthing process and doesn't always heal right. So it's a source of a lot of pain and frustration for a lot of women who've given birth. Okay, I think that's it. Oh, while I'm here, I might as well show you. This is a female pelvis, just for fun. This part's just for fun. This has a wide or obtuse subpubic angle. That's what we call that. Compare that to the male pelvic girdle, which has an acute subpubic angle. That's a bad example. Actually, just the general pelvis. Let's do hip and thigh. Anterior view. That's a way better subpubic angle for a male. You can also see on the male how the ilium is in the sort of superior orientation. It's sort of shaped more like a cup. Whereas when you go to the female pelvic girdle, we have this flaring out of that ilium. Those iliac crests kind of flare out like that, more like a bowl. Okay, that's not the only difference, but those are some major differences. So now you can go into a eccentric curiosity shop and see the skeleton that they have and be able to tell pretty much right away if it's male or female. Because that's a really normal human experience that I've definitely had. Okay, that's it for this video. Thank you for your time.